The femoral nerve is from ventral roots L2, 3, and 4, exit pelvis beneath the medial aspect of inguinal ligament to enter the femoral triangle. Branches are motor, iliopsoas, sartorius, pectineus, and all quadriceps muscles. Sensory is medial and intermediate cutaneous nerve of the thigh. Saphenous nerve is anteromedial aspect of the lower leg. Infrapedalar branches to the knee along the medial border of the tibia, ends at saphenous, with saphenous vein anterior to the medial malleus. Obturator nerve exits obturator foramen and divides into anterior and posterior branches. At rest via medial Lodloff approach. Anterior branch innervates adductor brevis, adductor longus, and gracilis, tested by adduction. Posterior branch innervates obturator externus and part of adductor magnus. Sensation of the medial aspect of the thigh and the knee. Hip pain can radiate to the knee because of this branch. It can cause chronic medial side pain from compression as by well-developed adductor muscles. Sciatic nerve is L4 to S3, exits pelvis through the greater sciatic notch, passes under piriformis, lies on adductor magnus in the thigh. Piriformis syndrome is a known extrapelvic sciatic nerve compression area. Decreased interrotation in femoroacetabular impingement can cause contracture of the external rotator, causes Severer syndrome. The branches tibial nerve, split from sciatic nerve in the distal thigh, passes through the popliteal fossa, continue distally under the undersurface of soleus, and passes into the foot posterior to the medial malleolus. Motor branches, semitendinosus, semimembranosus, gastrosoleus, popliteus, tibialis posterior, FDL, FDB, FHL, FHB, adductor hallucis, foot intrinsic quadratus plantae, flexor abductor digiti minimi, bicep femoris, long head by tibial nerve, and the short head is supplied by the peroneal nerve. Sensory sural nerve formed by cutaneous branches of tibia and common peroneal nerve, continue distally on lateral aspect of the tibialis anterior, terminate as lateral dorsal cutaneous nerve of the foot in the fourth web space. Final branches in the foot, medial and lateral plantar nerve and medial calcaneal nerve. Regarding the common peroneal nerve, it lies on medial border of bicep femoris, can be compressed behind fibula by ganglion cyst or injury to direct blow. Sensory sensations is sensory dorsum of the foot, terminates as medial lateral intermediate cutaneous nerve. Motor supply is lateral compartment, that is peroneus longus and brevis. Base is fascia 5 cm distal to the fibular head. Deep peroneal nerve is motor for the anterior compartment, tibialis anterior, EDL, EHL, and peroneus tertius, and EDB. Sensory ankle joint and first dorsal web space, passes through the anterior tarsal tunnel between EDL and EHL. Myalgia paresthetica is a lateral cutaneous nerve entrapment in the thigh. It's L2, L3, goes underneath the inguinal ligament, sensitive to the anterolateral aspect of the thigh, exacerbated by tight belts, prolonged hip flexion. Treatment is release the compressive objects and sets risk while harvesting bone graft anterior approach of the hip.